I want to tell you about what's going on in Tennessee. Down in Tennessee, speaking of movies, remember the movie The Hunger Games? Where it's like, hey, you're living in poverty out in the middle of nowhere, and you want to have a good life, you want to have health care, you want to have something decent, you have to do the lottery. Well, the Firesign Theater played a variation on this, on kind of what's going on in Tennessee right now. Way back in the 1960s, in their album Waiting for the Electrician or Someone Like Him. Let me set the scene. This poor schlub gets kidnapped and dragged into this game show. He wakes up in this game show and discovers that he's on a game show where they shoot you up with a disease, and you have 10 seconds to figure out what you've got and beat the Grim Reaper. Beat the Reaper. And, well, here's how it turned out in the Firesign Theaters. By the way, their website, firesigntheater.com. Here's how it turned out in their version with permission of the Firesign Theater.
He's coming around, folks. He's gonna be okay and ready to play Symptom 6 of Beat the Reaper.
Last week, our patient successfully survived the common cold, measles, pneumonia, dengue fever, and the yaws.
And now, the big question. Are you ready to go on?
What? Where?
He's ready!
Our topless nurse, Judy, is wheeling our patient into the isolation ward.
Can you hear me in there? Okay, let's shoot him up. Now, patient, you have 10 seconds to tell us what you've got and beat the Reaper.
I'm shaking, feverish. My hands are all... I'm turning yellow. My God, I've got jaundice.
Jaundice it is! Give him the...
Oh, he actually identified the disease that time, but here comes another one.
Reached the final threshold. Here's the question. Are you ready for symptom number 7? Longer than any patient has ever survived before.
I want to go home.
Only one way to do that. Doctor, bring in the super shot.
Now, for the first time on Beat the Reaper, we're going for the big disease. The icebox is being unlocked by the president of the Armenian Medical Association, under whose strict supervision these toxins are being administered.
This is it. Doctor, give him that really big disease. Now, patient, can you hear me? You've got 10 seconds to tell us what you've got. And for the last time, beat the Reaper!
I feel... I think I feel... I don't know, whatever it is, I want to die.
Oh, I'm terribly sorry. That's not correct. You didn't beat the Reaper. Doctor, bring the patient out and show the amphitheater audience and all the folks at home just what he's contracted.
According to my careful prosthesis, this man has the plague.
Thank you, Doctor.
You're welcome.
You've got the plague. Well, isn't he a good sport, folks?
Well, isn't he a good sport, folks? Yes, you have the plague. It's the lottery, right? It's the game show. Well, a variation on this is going on in Tennessee right now. Because of Republican Governor Bill Haslam. I think I'm pronouncing that right. Haslam. He is the Republican governor of Tennessee. 180,000 people in Tennessee are eligible for health care under an expansion of Medicare. These are all people who are blind, elderly, disabled, or the caretaker of a child who qualifies for Medicaid and themselves are low-income people. You have to fall in one of those categories. 180,000 people, and right now they have no health care. They have no health insurance. So they're not going to beat the Reaper. So twice a year, what Tennessee does is they have a lottery. They open the phone lines. The phone lines are open, folks. This happened yesterday or the day before. This is the twice a year thing. And the first 2,500 people who get through, they take their calls and they send them an application for this health insurance. And if they qualify, and presumably only people who are calling would who would qualify to call, then 2,500 people out of the 180,000 who would be eligible for it, 2,500 people get health insurance under Medicaid. Now, Obamacare, as passed by Congress, would instantly give all 180,000 qualifying people in the state of Tennessee free health insurance. Ding! Just that fast. But when it went before the Supreme Court, in their infinite wisdom, one of the things that the justices said was, you cannot force a state to take federal money. Even though for the first 3 years it's 100% free to the state, the federal government will pay for all of it, all those 180,000 people. And after that, the federal government forever is going to pay 90% of it. You still can't force a state to take money. So the governor of Tennessee has said, I don't want that money, as have the governors of many Republican states. So a couple days ago, they opened the phone lines and 2,500 people called. And I mean, you read the stories of this. It is just absolutely incredible about people who are dialing over and over and over and over and over again. And in fact, they even suggested that people should have, here, this is state residents who have high medical bills but would not normally qualify for Medicaid. The government health care program can call a state phone line and request an application, but the window is tight. The line shuts after 2,500 calls, typically within an hour. And the demand is so high that it's difficult to get through. Russell Overby, a lawyer with the Legal Aid Society in Nashville, said, it's like the Oklahoma land rush for an hour. We encourage people to use multiple phones and to dial and dial and dial. Yes, you too, if you live in Tennessee, can try to beat the Reaper and be one of the 2,500 lucky people out of the 180,000 people who would qualify if your Republican governor would just take that free Medicare money that Obama is offering in Obamacare. But he's a Republican, so he wants you to suffer, so you will blame the federal government. You get it?
This is the Thom Hartmann Program.
So in Tennessee, so sorry, you didn't beat the Reaper. But isn't he a good sport, folks? He's going to reelect a Republican.